Hey, this is Matt Zelog from the Athletic Performance Center. We're gonna do a quick video today on teaching hip hinge and progressions and regressions of both. We're doing this video because it's important for your patients to learn how to use their posterior chain. And not all patients can bend down for a squat, so they need to get used to bending through their hips and get down and grab something off the ground. If you have any questions, obviously give us an email at apcenter@ehr.org. And I hope you guys appreciate the video we're giving you. Thanks. All right, today we're lucky enough to have Avery. She's gonna help demo these exercises with us. The first thing I'm gonna work on is just teaching basic form or basic positioning for that hip hinge. One of the easiest way we do this is we use two small plate weights. We put them on the ground, about shoulder width apart. It could be a small plate or slightly thicker depending upon how much dorsiflexion somebody has. So Avery's gonna step forward so that the balls of her feet are on those plates, her heels are still on the ground. What I'm gonna do next, just to make sure she has really good form, is I'm gonna bring in a dowel. I'm gonna place the dowel on her back. I want her head in contact with the dowel, her back and her butt. From this position, she's gonna grab the dowel here, where the crack of her neck is, or the crevice of her neck, and she's gonna put her hand behind her back and grab it. She's gonna remain those 3 points of contact on her head, back, and butt. Now she's gonna soften her knee, and she's gonna push her butt back towards the wall. Good, and the reason why we soften the knee, come right up tall, Avery, we soften the knee because not all people can go to a hinge position with a straight leg because their hamstrings are too tight, and also because if you keep your legs completely locked out, on the lift motion you'll tend to use your back a little bit more. We want to work on the posterior chain, primarily using those glutes and hamstrings. So Avery's going to go again. She's going to push her hips back, remain with 3 points of contact. And you're going to think here, Avery's going to keep pushing her hips back, because if she stays too tall, she's going to fall backwards. So Avery keeps pushing her hips back. Good, she's gonna come right back up. What I wanna do here is I want Avery to get a little bit deeper. But as she gets deeper, I wanna make sure that she keeps her knees behind her toes. So I'm gonna bring a second dowel in, I'm gonna place it here, and Avery's gonna go to that same position. She's gonna bend down, and I don't want her knees to touch this. So Avery's gonna keep pushing back. As she does that, instruct your patient to push their hips behind and let their upper body drop a little bit as they remain those 3 points of contact. If you look here, Avery's toes are basically in front of her knees where they need to be. As she pushes up, she's gonna push through her heels, extend her hips, and give a good glute squeeze. Good, thank you, Avery. I wanna show you one way we can kind of cheat with this exercise, because even when we add these plates in, sometimes as you can see, it's still hard to get that hip hinge position. So what you wanna do is you wanna bring in a band, right? You can use a TheraBand. This is a super band that we have. You wanna hook it to some sort of base of support. We're gonna use the rack behind us today. What I'm gonna do is I'm gonna hook this so it's waist height for Avery. Now she's gonna step into this band. It's gonna be at waist height for her, and she's gonna walk forward now to those 2 plates we have out in front of her. So Avery, turn towards me to the plates. She's gonna walk out. She puts her toes only on there. And as you can see, the band's already pulling her back. And the reason why we're doing this is because people can't hinge the hips correctly. Hold on one second, Avery, I'll bring that back. Good, come forward again. If people can't hinge correctly, this band now is acting to pull her hips back where I need them. Avery, it can't be that difficult, is it?
No, just keep falling.
Good, come forward again. Good. So now what's gonna happen here is Avery's gonna let the band pull her hips back, drop her upper body, go ahead Avery. Remember soft knee, remember not leaning forward Avery, so get that hip back. Good, chest is out. Now she's gonna extend through her heels, come up to triple extension, so ankles, knees, and hips are straight out, okay? You can see Avery's fighting with that tension, so we're gonna find a tension that she can be comfortable enough, but still feel like she's getting that pull from behind. So Avery's gonna place the stick behind her back again. Good. You need the 3 points of contact, head, back, and butt. She's gonna let the band do its work. She's gonna push her hips back, let the band pull her. And you can see she's still fighting with that knee position. Keep going, Avery, down. Look how much better that position is for Avery. Now she's gonna push through her heels, come up, push that band forward. Good, she's gonna squeeze her glutes to make sure that that posterior chain is kicking in. What we don't wanna do is we don't want that low back doing the motion for her. So she's not extending up towards the ceiling. All Avery's doing is she's pushing her hips away towards the pulley. Go, Avery. She's sitting back, hips go away, and then she's gonna push her hips forward. Good, all right. One other way we can do this is I can take away this wooden dowel. I can keep the plates here. What I can do is I can bring in a kettlebell. And Avery's now gonna hold this kettlebell behind her back. We call this a handcuff position. So Avery's gonna hold this kettlebell right here behind her back. She's gonna take a step on these plates again. All right? And now she's holding that kettlebell. She's gonna keep her shoulder blades squeezed and chest up. She's gonna soften her knee. And I want Avery to think now that she's going to push the kettlebell away. Soft knee position, very good. Keep that chest out. You can see when she holds that kettlebell, it forces her to keep that good position. Now she pushes off her heels, squeezes her glutes and comes back. Try about 3 of them, Avery, okay? She pushes away, good. Comes up, gives a good squeeze, pushes away, comes up. And you may have to give cueing like I do to Avery, but really work on pushing those hips back. All right, go again, Avery. Sometimes I'll put some pressure in front of the knee to force them into that position. You can see how hard it is for Avery. Good, Avery, I'll grab the kettlebell. Awesome, Avery, you can step out of that band. So those are a couple really quick, simple ways we'll start off. So again, plate weights on the toes. What it does is it takes away that dorsiflexion from their ankle. So they have no more dorsiflexion. They can't keep going in that squat pattern because they're locked out. So they have to push their hips back. If you're still finding they're having a hard time getting that hip movement, you can bring in the band, right? If you think that their back position has been very poor, we can bring in this dowel, right? To get those 3 points of contact. And last but not least, we walked in and we grabbed that kettlebell more in that handcuff hip hinge position. A couple other ways we can work on things, and sometimes can be easier for patients, is I can bring in an AirX pad, and I can have Avery go in a full kneeling position. So both knees will be down. And the reason why I don't always use this one is because not a lot of people can get in a kneeling position. If you have an older patient or someone that's suffering from a knee injury, they may not be comfortable in this position. So now as Avery's there in this position, she's gonna have her hands behind her back again, and I can work on that hinge position. So she can rock back, push her hips away, and then come up, squeeze her glutes and have her hips come forward. So try that a few more times again. Good. Come up, and we can groove that hip pinch position being more in that kneeling stance. All right? So that's part 1 of this. Give me a few seconds, we'll set up part 2.